is Tiffany Jennings, and I'm a registered nurse with experience in geriatric psych, women's health, pediatric clinic, and med-surg. I've selected the article, The Nursing Profession, Public Image, Self-Concept, and Professional Identity to discuss the image of nursing in popular culture. The image of the nursing profession plays a considerable role in how our patients, the general public, and other healthcare professionals perceive our capacity as a nurse. Traditional images of the nurse as the doctor's handmaiden are based on misconceptions and stereotypes which unquestionably do not reflect nurses as educated members of the healthcare system that operate autonomously. The article explains how the patient's view of the nurses is that nurses are generally prized for their virtues and not their knowledge. Caring for patients is and always should be a core value in the nursing practice, but it's important to demonstrate to the public that it's much more than just sitting at the bedside. Nurses are advocates, leaders, researchers. Patients are actually unaware nursing research exists and how important it is to their health. Nursing research is designed to improve patient care by providing evidence to support nursing practices. By participating in the research, representative bodies, or even leadership roles, nurses can improve their own professional identity. There are a vast number of leadership roles nurses can obtain in order to advocate in the decision-making process. The more leadership roles nurses partake in will directly reflect their scholarship and professionalism. The article also discussed that although nurses see themselves as well-trained professionals, the public still sees nurses as a low-status profession that is subordinate to the work of physicians, does not require an academic qualification, and lacks professional autonomy. The general public clearly is oblivious to the different levels of education and professionalism involved in nursing. Nurses are highly knowledgeable, qualified, skilled, and more nurses hold a doctoral degree than ever. Additionally, nurses offer a vital and very unique perspective to the healthcare team. Interprofessional collaboration and gaining respect of their other healthcare professionals improves the team members' perspective of nurses' capacity to help improve patient outcomes. The article mentions the poor communication of nurses with the public and the invisibility of nurses in the media. Nurses need to take a stand to correct these images. The Nurses Code of Ethics highlights in the Provision 5 of preserving integrity and continuing professional and personal growth. It encourages nurses to safeguard the image of nursing as a duty to self. Provision 6 of establishing, maintaining, and improving healthcare environment calls for nurses to take active roles as leaders to create this safe environment. Nurses need to raise public awareness about the various roles and opportunities both basic and advanced nursing practice have to offer. The article also encourages nurses themselves to establish a public image and professional identity that recognizes the value of their professional and educational development to help correct this negative perception of nursing and display what nurses really contribute to healthcare. Thank you.